Alright girl, so I did the best I could to go through my experience in hygiene school. I hope that I covered everything. If I feel like I left anything out, of course I'll make another video. If you have any questions, I'm gonna keep saying this. DM me on Instagram. Send me a comment on TikTok. Like, I'll try to get back to it. Sometimes TikTok doesn't notify me when I get comments, so I have to go back through all my videos, which is hard to do sometimes, but I do it. And yeah, so the next video I'm gonna do is basically like any more questions about clinic and everything, and then like questions about boards exams and like the next part of it and everything. But people asking me about preparing for entrance exams. If I was in a school, going to a school where they had entrance exams, which I didn't have to take an entrance exam. If I took an entrance exam, I would say to go online and find practice entrance exams for that test, for that subject that you're having to study for it for. Ask the administration and the advisors in the school, what grade do I need to pass this? What kind of grades do I need? Do I need a B? Do I need a C? Do I need an A? Just so you can get mentally prepared for how serious this test is. But as far as I know, these entrance exams are only for you to be able to, or be able for them to see what you know. Like, what do you know about the subjects that we're going to be teaching you? So we know how to teach you better. It's like for placement. So I would not necessarily worry about it unless your advisors at your school say that it's a serious test to be worried about. But like I said, I would just be studying exams that I find on Google, Quizlet. I would ask them if they have any testing and study resources for it, if there's any programs in the school that are free or whatever that they would suggest studying for it for. If there's like a Saturday program that you can go to real quick, 2 to 3 times, and just like kind of see how to study for this exam. You know, that's what I would do. And then I would also reach out to people on like Dental Hygiene Talk. That is a Facebook group that you can get into. There's so many Facebook groups on dental hygiene. I would just go and find them. See if you can find somebody on Twitter who's taking the exam for dental hygiene. But just find as much resources as you can on, and do your research on the exam. And I would study at least an hour a day until it's time for me to take the exam. And just do my best, you know? You don't want to like stress yourself out to try to like, oh my God, I need to pass this, like, because I want to get into school. Like, don't bring yourself surrounding anxiety. Just do your best. It's a test for you to learn, for them to learn what you know and to place you. That's it. That's what the exam is for them to place you. And if you, for some reason or another, don't pass the exam, don't stress about it. Like, you might not know everything. Like, it's okay. Like, this might be the first time you've taken school in a while, you know? Maybe you're not a great test taker. It's okay, you know? But I would just necessarily focus on trying to get as much resources as I can so I can study and prepare for it and know what the passing grade is and know what the passing rate usually is. Do people usually pass this exam? No? Okay, so is there another exam that I can take that is equivalent to this one? Like, just negotiate with these advisors and these administrators. Let them know, hey, I took anatomy, I took physics, I took biology, I took chemistry, I took all these tests and all these exams and all these classes, and I passed them really well. Is there any way that you can like waive my entry into this exam? Like, I know all this already. I got a B in anatomy. I got an A in math. Like, whatever it is. I got a C. You know, whatever it is. Whatever grade it is. Like, pitch yourself. You never know. Somebody might be like, you know what? You're right. Let me speak to the board advisors and the directors and see if they can just waive you. You never know what could happen. Like, you know, apply to multiple schools. Keep your options open. If one door closes, another will open. Don't put all your eggs in one basket. That's all I could say. That is what I learned. That is what I could, that's my best advice I could give you. Don't put all your eggs in one basket. Apply to multiple dental hygiene schools. Apply to schools in universities and apply to schools in trade schools. Apply to schools in community colleges. Apply to schools outside of your state. Apply to schools in your area. Do not wait on nobody's waiting list. Get the fuck out of there. Move if you have to. Pick up your family and move. Move and leave your kids if you have to. I know that would be so sad. I don't want you to do that. But if this is your dream and this is what you really want to do, if you want to make more money, if you want to do better, if you want to have a career you could use for the rest of your life in sales, in education, in every kind of way, then get to the bag. Like, you got to do what you got to do. But remember, it's like, it's for 2 years. You'll be okay. You'll get through it. You've been through worse. Trust me, you have. So, I hope that this helps. And I'll see you guys next time.
All right, hey, this is Editing T here. I just wanted to add a little bit more to this video because it would have only been like 7 minutes. I thought I was going to have like a really long part 2 because the camera cut off. But I'm looking at the footage now and it was not that long. My main concern with making these videos is making sure that I don't impress on you guys that hygiene is like this amazing career and like there's nothing wrong. It's a whole bunch of fun and nobody's like sad here and it's amazing and we make all this money. Like, I want to be completely transparent and be honest with you that it is so hard, okay? I make it look easy because I can only show you clips of what I'm doing. Okay, I can't show you everything I'm going through. I cannot have you like literally watch me do everything that I'm doing every single day. Like, I'm only showing you clips on TikTok. So my main goal here is to help someone, and I hope I'm helping you by making these videos, and I hope that I'm helping you understand more about the dental hygiene path and career. But school was so intense. That's all I wanted you to know. Like, school was so intense. It was all about patient care, all about information, you know. Like, in the real world, you're only seeing a patient for 1 hour. In school, you're seeing patients for 3-4 hours at a time. You're not only doing that, you're juggling so many different things. And you have to really be committed to this, you know. Once I got out of school, I had to transfer back to New York because I wanted to move back to New York from Connecticut. And I had a really hard time finding a job once I got back to New York because obviously I was a new grad. They don't want to hire you right out of school. So I signed up with a temp agency to work over there. And my first job was like a horrible job. I was making more than the hygienists that were there, but I was making less than what I thought I was worth at the time because I was only seeing patients every 30 minutes. So this was the column, and I'm literally like staggered. Like, they think staggering the schedule is like not side booking, but it totally is. So the patients were literally like be seated in my chair at like 9 o'clock. And 9:30, my next patient would already be there. And I still had to take a full mouth set of x-rays. I still had to chart, which is like basically looking and seeing what teeth were there, and like actually physically do the cleaning. And that depends on how healthy their mouth is, because it could take me 20 minutes to clean somebody's mouth if it's unhealthy. Still have the doctor coming in and do an exam. And most of the time, doctors have you wait forever because they're too lazy to get out the chair. They want to just finish what they're doing. Still make their appointment, check them out. It was like, how am I going to do all of this in 30 minutes? Like, I would not suggest working somewhere where they only give you 30 minutes per patient. Like, your patient care is going to be so off. You're not going to be able to give them the best quality care that they deserve. And I really hope that you work somewhere where they give you an hour. Work somewhere where the doctor cares about you, cares about your well-being, cares about the patient's well-being, cares about the staff's well-being, because some of these companies and these doctors, if you work for a private office, they do not, okay? They don't give a fuck. They don't care. They don't care about nothing but they money, they bag, okay? And at the end of the day, every profession is about money, but you don't want to be somewhere where you literally have a doctor who's super lazy, who does not want to do anything. And every time you tell them about something you see in a patient's mouth, they're just like, shrug. And so that's like a super conservative doctor that we call like a watch and see dentist. And then you have the doctors who are like, they see one little speck of a cavity and they're ready to do a crown, a cap. It's like, now you know you're doing the most, right? Like, you don't need to do that. Like, that's damn near neglect. But being a hygienist is lucrative if you make the right moves. Make the right moves. That's all I could say. If you're going to be a hygienist, you better be getting into this because you like patient care. You want to help people. And you don't want to go to school for 6 years. Like, and you want to give your family a better life. You want to, you know, have a career that you can use in every state. Like, you got to have more reasons why other than just the money, because you'll hurt your feelings if you think you're just getting into this for the money. So I'm sorry that this video wasn't like super high quality. I'm really trying with this YouTube thing, like trying to edit and post during the week and post TikToks and answer comments. So just let me know if you have any questions about hygiene. I definitely will try to reach back out to you. You can email me, text me, well, message me on Instagram. And if I don't see a comment on TikTok and you ask me something, please message me back on there. I'll try to get back to you. But I appreciate you guys all the time. And if there's anything else you want to know, just hit me up. Bye. Let me know what you want to see next too. It's really important. I need to know what else videos I need to make, because if not, I'm about to just post try on hauls all the time.